That's such a critical question. So many of the issues that we are confronted with, if not all of them, are going to require intersectoral solutions and partnerships for those solutions. They also are often found to have intersectoral causes. So, what's the role of schools of public health? Schools of public health are the entity in society that is really mandated to create the scientific knowledge about how to create health, how to prevent disease, how to preserve the health we're born with, and how to actually create health and prevent disease across the whole life course. That science needs to be used as well as invested in, because in fact public health science and public health practice creates 70% of human health. And it does it by creating the conditions that are healthy for us, potentiating the ability of individuals to practice healthy behaviors, shaping the norms that really make our health, creating the cities that drive our health, and then actually creating the science of prevention that needs to be in one-on-one medical care. Business uses public health principles all the time in workplace wellness programs, but so many of the issues that GBC Health today is talking about really have to be intersectoral in this solution. The science of population health and public health needs to be understood by everybody, and I hope that increasingly there will be sharing of knowledge across schools of public health and the business community. And then that knowledge can help us understand the ways in which we're all in this one together, because there are so many where we have to solve them together, and how academia can help business see ways forward, how business can propel the science and education and innovative models that academia is charged with developing. We have many of these kinds of partnerships, but I think the complexity of the health issues that we're confronted with and the necessity to understand the return on investment in prevention and to invest in prevention as the most cost-effective way to create health for everybody has to be at the partnership level ultimately. So I think today in the dialogue I had with Commissioner Farley, we laid out a number of ways in which business plays critical roles in terms of creating health in partnership with government, in partnership with whole cities. That goes from being in on the prospective planning of cities of the future. 50% of cities are going to turn over, be redesigned, rebuilt, built de novo in the next 30 years, all over the world. The context of cities create the health of the workers that businesses employ and amplify the investment in workplace wellness. And so cities should have a deep investment in how these cities are redesigned and rebuilt as they go through their cycles of regeneration. That includes the built environment. Everything about the built environment amplifies or hampers the health and well-being of workers. It includes the design of transportation so that not only is decreasing our carbon emissions, but creating equity of opportunity for workers to get to work effectively. It includes the opportunity for innovation. So as cities could be redesigned, there's huge opportunity for corporate innovation and the corporate sector to really be building, creating the infrastructure we need for the future in partnership with government, and using public health principles to ensure health and well-being. I think at every level, the issues of creating the health of cities, designing cities of the future, has to have a partnership at every level where business is central, and business will benefit tremendously. The World Health Organization has called for cities all over the world to declare themselves age-friendly, and to do that by investing in the design of cities so that they actually support the well-being of all of us as we get older, our continued engagement, our access, the services we need, and the friendliness of businesses to actually support older customers. On every one of those counts, business has a role to play, and the benefit to business is large. In New York City, I have the honor of serving on Mayor Bloomberg's commission to make New York an age-friendly city, which is doing very exciting, innovative interventions jointly between government, business, and academia, jointly designed, jointly implemented, which include creating a certificate for age-friendly businesses and retail businesses across New York that actually meet our new criteria for access, for service, for facilities that accommodate provide places to sit down for a minute and rest, that make sure that products can be reached by older people, that they're not put in jeopardy. All of these things actually really make a difference in terms of drawing older people to their business to shop for retail businesses. So there are many, many aspects of an aging society. The biggest one, I think, that many corporate employers are confronting is realizing that older workers provide really important social capital for their businesses, and they don't want to lose them. And so they are moving to thinking about flexible approaches so that older adults can be retained. These are critically important to actually being successful in retaining this real wisdom and experience of older workers. Some of the things that businesses could think about in addition to actually how to structure roles is whether there are new kinds of roles in their corporations that could capitalize on what scientists are learning are the unique capabilities of older minds. Not just highly experienced, not just a lifetime of experience, not just having well-honed abilities, but in addition, some cognitive abilities that develop over time in terms of being able to tackle complex problems, recognize them, have the patience to hang in there with them, the ability to discern what's really important, and the capability actually to bring people together for their solution. Many of the roles in the corporate sector, in academia, and government were designed when life expectancy was 47. We haven't considered what science tells us are the capabilities of older adults, and some of them are quite unique and could benefit all sectors, including the corporate sector, if we learned how to harness them. Cities are laboratories for public health policies and interventions, and the corporate sector needs to be part of both recognizing that and supporting what is essential to create everybody's health. We are learning so much about how the context of cities shapes health, and I'll give you a couple of examples. A number of years ago, one of the groups of my faculty in our program on climate and health and our program on children's environmental health at the Mailman School of Public Health did groundbreaking research which showed that the epidemic of asthma in young children in Harlem in New York City was heavily due to inhaled emissions from diesel buses, which idled in that poor neighborhood and were parked in that poor neighborhood. The city then needed to invest in purchasing hybrid buses, which actually have made a huge dent in the problem of the asthma epidemic in young children. They needed to look toward the corporate sector for innovation, and the corporate sector had to be anticipating the opportunity to design new kinds of buses that would create health. One example, There are many transitions we need to make to have both healthful and sustainable cities. Some of them are going to require real adjustment by the corporate sector. Many of them will require real leadership in other sectors as well. But these issues are so critical to all of our health that we need to recognize the science and sit together to accept what the evidence says are necessary solutions, and then figure out how to make it maximally cost effective to make the transitions to the demands of our 21st century world. Public health professionals work very hard to create the science to understand what's affecting our health, and then to try and figure out where the key levers are that could give the maximal benefit with the highest return on investment. Some of those levers actually will solve the problem, but often the problems we're confronted with need many solutions, but incremental flipping of the key levers is essential. The soda tax that was proposed in New York was analyzed as a key lever, as a key place where young people are ingesting soda, and that's driving the obesity epidemic. Not the only place by any means, but one that could both be a driver of changes in behavior broadly as well as part of the solution itself. Proposals like that, when based on science and evidence, need to be considered seriously and seem to often generate resistance from different quarters. There are so many threats to our health, and some of them, like the obesity epidemic, are very serious to our future. And we have to have the ability to talk together and embrace sometimes difficult solutions, sometimes obvious ones. If all we embraced were the easy ones, we would only solve a small fraction of the problems we need to solve. Take the question of polycystic aromatic hydrocarbons. Ubiquitous liners of plastic bottles. Produced by the corporate sector, plastic water bottles clearly have filled a huge human need and desire to have liquids that are portable, that go everywhere. But we're now learning some things that are deeply concerning about how those water bottles are constructed. That polycystic aromatic hydrocarbons that are emitted by those bottles appear to be inhaled when they get stuck on the particulate matter of air pollution. And in our studies, led by Drs. Robin Wyatt and Andrew Rundle, when pregnant women inhale those polycystic aromatic hydrocarbons, the children they give birth to are at a 6 to 7-fold higher risk of becoming obese. Now, when we look at evidence like that, perhaps we need to tackle evidence like that to say, well, does that suggest we need a new solution on the bottles issue? These are not issues, when they're science-based, they're not issues to fight over, they're issues to say, okay, how do we fix it together? This is really a key issue. It's a key issue certainly in cities in the United States, but it is a generalizable issue in many cities and countries of the world. There are many factors that drive youth violence. A large proportion of them are actually things that we work on in public health from a prevention point of view. Issues of poverty and homelessness and exposure to violence in one's environment, vulnerability to substance use in people who don't have optimism and who don't have jobs and who may not have adequate education to be employable. This turns into a vicious set of vicious cycles and a very complex web, which sets young people up in dense populated areas where drug use, for example, may become the currency by which people earn their living, to really foster violence. In the U.S., this has been approached over the last 30 years by criminalizing things like drug use, by mandatory sentencing. This does not appear to be serving us well as a society, and we need to look for many reasons. One is the huge prison population that the U.S. now has, and that a quarter of young African American Hispanic men in this country are in prison or are somehow involved now with the prison system on parole. And we must look to creating different pathways for hope and violence prevention in our communities. I do believe, actually, that putting a public health lens on this through shifting the conditions that in combination seem to be making these young people vulnerable to violence and vulnerable to ending up in jail is the right way to go. It's a novel question, but one that I'm very proud that our school has led on beginning to tackle. But we need to look to humane solutions that build cohesiveness and don't destroy communities, and preventing violence, I think, is a key part of that. And there are generalizable lessons as we figure out how to do that. There are resources in communities that we don't develop or tap that could give young people alternatives to violence, that could put them on pathways where they actually have optimism and hope and health, and are not threatened by the destructive aspects of worsened mental health, depression, anxiety, fear, which can be endemic in violent communities.